Good afternoon, everyone. Hi, this is Dr. Paul Zeitz. It's Wednesday, March 25th, 2020. It's 3 p.m. Eastern Daylight Time. I'm here today for my live chat, my daily live chat, to talk about the COVID-19 pandemic and how each of us can work together, join forces to protect ourselves, protect our families, protect our community, and take action to ensure that the response here in the United States and around the world is being optimized and improved so that we can save as many lives as possible. Today's update on the state of the pandemic is that there are over 450,000 confirmed cases around the world. China still has the most number of cases with 81,000. Italy is ranking second with 74,000. And here in the United States, we have over 61,000 cases that have been reported. There's been a total of more than 20,000 deaths, with Italy having the highest number of deaths right now at over 7,500 deaths. China, in comparison, only had around 3,000, little more than 3,000 deaths. So Italy has more than doubled that. The total number of deaths in New York is at 192, and the total number of deaths in the United States, I'm trying to get that data to come up here, but we're in the couple hundreds right now. So the epidemic is raging forward, and we need to take this opportunity to work together in new and different ways as we try to confront the pandemic. Many of our lives have been altered. There's about half the country that has gone into shelter in home. There's a great website called covidactnow.org. I wish I could project it. I can show you the screen of it right there, and you can see in the red states, there's only limited action being taken. In the orange states, there's social distancing that's being implemented. And in the, beige states, there are shelter-in-place orders. So as you can see, the red is very little action. That's like an alarm bell. In the orange, there is social distancing being implemented. And then in the beige states, there is a shelter in place. This is progress in that more and more states are implementing more aggressive shelter-in-place orders and more social distancing orders. It's gravely concerning to me as a public health physician, a doctor, that we have 3, 6, 9 states where limited action is underway. That's really dangerous. And most of the states are only implementing social distancing, and only, maybe 10 or 12 states are implementing what is recommended now, which are shelter-in-place orders. I think that public health experts and medical experts are shaking the trees around all of our political leaders at the local level, the state level, and of course at the federal level to move rapidly towards a national shelter-in-place order or guidelines. This is something that needs to happen last week. It needed to happen yesterday. It needs to happen today. And I think what we need to do is wake up and start mobilizing ourselves to call on our local, state, and national leaders to implement a shelter-in-place order or guidelines. I think that areas that are heavily affected, like New York City, are going to move beyond social distancing into shelter-in-place orders very quickly. There even could be localized quarantines that are in place. And ultimately, if the epidemic continues to spin out of control, there could be a national quarantine order. There's also the possibility of martial law being declared. We know that other countries already, in the Philippines, for example, the government is implementing martial law in parts of the Philippines in response to the COVID pandemic. So the spectrum of response from governments go from limited action, which is now happening in 9 states, to social distancing, which is happening in about 20 states, to shelter in place, which is happening in about 15 or 20. I'll get the count ready by tomorrow. In the United States are in shelter in place. There are governments around the world that are shelter in place. The UK, Germany, Spain, Italy, India went to shelter in place yesterday. So the successful countries that controlled COVID-19 are China, South Korea, and Singapore, and they all had very aggressive shelter in place, restrictive, halting interventions, and that was what was necessary in order to control the COVID-19 virus. So I hope that here in the United States we can quickly move towards a shelter-in-place national baseline of public health measure. The kind of discussion that came out of the White House yesterday about trying to open up the country in April around Easter is a nice fantasy. It's not even what I would call optimism. It's more like a delusion, because if you understand how the epidemic is going to be unfolding, we have in New York City, for example, the peak of the localized epidemic in New York and New York City is going to peak in 14 to 21 days. So whatever they're experiencing now is just going to continue to get worse and hopefully peak in 14 to 21 days and then maybe come down after that. So we're talking about April, May, and other parts of the country will peak at different times. So Atlanta might peak in May and then go May, June. And Birmingham, Alabama, New Orleans, Detroit are all starting to see increasing rates of infection. Grand Rapids, Michigan, and all these cities that I'm naming, their hospital beds are running out. The ICU beds are already reaching their limit. So we're just in the early days of this, and I want to say the worst is yet to come. And so I think what we have to do now as citizens is to take aside our worry and use that worry and transform it into action. And we have to call on on our political leaders to take bolder action now to protect the people. The other element I've been asked about is what else needs to be happening. So we have an End COVID campaign which has 3 elements: protect the people, test the people, and treat the people. And we're working on mobilizing political action to demand better action on protecting, testing, and treating all of the people in the United States and, of course, around the world. Protecting the people also includes ensuring that we have all people in the United States have a comprehensive, justice-based safety net. That includes food, housing, income, clothing, comprehensive job skills, unemployment benefits, social services, and healthcare, including mental health services, through the duration of the COVID-19 pandemic. So when we say protect the people, we're talking about aggressively implementing social distancing and containment strategies, as well as a comprehensive justice-based social safety net. In terms of testing the people, we're advocating for free point-of-care rapid COVID testing for every person that needs testing as fast as possible. And we demand that these test results are returned to people within hours, not days. Here in Maryland, there are some people getting COVID-19 tests that don't get their results back for 5 or 7 days. That's absurd. China had rapid tests that were available, and the results were available within 4 hours. So I think we have to push our leaders to use the technology that's already available in other countries. I spoke to a colleague in Tanzania, and they're using the WHO-approved test that was developed in China in Tanzania, and people in Tanzania are getting results back in several hours. So I don't understand why here in the United States it's taking 5 days or 7 days, right here in Maryland, where the National Institutes of Health are, right around the corner here, where it's taking 5 or 7 days to get test results. I think we can do better, and I think we have to hold our government accountable for doing better. In terms of treatment, that's the third pillar of the End COVID-19 campaign. We are advocating for free health and medical services for all medical conditions. Our health providers urgently need to be provided with personal protective equipment, and we need a rapid surge of hospital beds, respiratory ventilators, new therapeutics, and ultimately vaccines to everyone that needs it. This is a serious gap right now in our national response, and other countries are also facing similar challenges. So I think what I'm trying to communicate today is let's join forces together and work on protecting, testing, and treating the people. Let's organize ourselves around that. So that is something that I feel like it is very important, and I'm glad that I was able to communicate that with all of you today. There are a lot of questions coming in on the live chat, and I would like to ask the people that are supporting me to please put the questions that are coming in on Facebook into my text message, because I'm having a hard time seeing them on the screen right now. Let me see if I can get them up here. I can't get them on my computer right now for some reason. So if you could help me by texting it to me, that would make me be able to see it right away. Okay. I'm still working on trying to pull up those questions on my computer. So I wanted to start by answering the questions that I've been getting. Earlier this week, we talked about how to deal with stress and anxiety. We shared a 5-step approach about dealing with mental health. So, and supporting ourselves as we are dealing with this COVID emergency. Thank you, Emmett, for putting up those questions. I'm going to try to get to all of them in this hour. So mental distress is a very important thing that we should all be aware of. We're all under stress and anxiety, and we all have to manage that. And the more that we can manage it, and the more that we can generate ourselves as calm, then we can help others around us also be calm. So of course, we're all feeling stress and anxiety with all the uncertainty, with all the unknown that's going on. There's fear about ourselves getting ill. I certainly have worries that I'm going to get sick, or my loved one, my wife who's out working as a doctor, my family, my mother, my elders in my network. There's a lot of fear about that. So I think the first thing that we have to understand is that fear and anxiety puts us into a fight or flight mode. We get into a stressed out mode. And it's like a panic button that emerges. So one thing that I can offer about handling stress and anxiety is to focus on the things that and I'm trying to do this for myself, what I can control, and trying to separate out the things that I cannot control. And each of us has different things that we can focus on that helps us distinguish between what we can control and what we can't control. So that's the first practice that I'm working on, is what are the things that I can control and what are the things that I can't control. So for me, one of the first things I did all last week was I wanted to make sure all of my family were in pods or groups where they could hunker down for weeks and months, depending on how this COVID-19 pandemic unfolds. So it was really important for me to make sure that all my loved ones were safe and were in a pod that was settled for this time period, and recognizing that this could go on for longer than any of us can imagine. So preparing ourselves that this is not a 1 week or 2 week, this is weeks and possibly months of being hunkered down in a shelter and home kind of thing. So like getting my family, that was something that I could take action on and that I could help facilitate, and I could offer coaching to people on that. And I'm still taking calls from friends and family, talking through the options. And what I've learned from that is that it's really important to say that everyone has to make their own choice. There's no right or wrong. And it's important to also taking the time to think about different scenarios. So if you're in one place now and someone gets sick there, how are you going to isolate that person? If someone gets sick and they need medical care, how are you going to get them to the right medical care? And then you also have to figure out where you're going to be. Sharon, I thank you for your message. I am getting all your questions and I will be coming to them. So thank you for that. We have a lot of questions coming in. I have your questions in the queue. So thank you. Just quickly on the managing stress and anxiety, there was Dr. Yip who spoke on a Washington Post broadcast. She recommended the following 5 steps. Get up and get dressed. So thank you. These live chats every day have forced me to shower, shave, put on a shirt, and be ready to talk with all of you. So I am practicing that by getting ready for these live chats every day. It helps you feel good. It's a form of self-care. You have to look in the mirror and make sure you're looking good and feeling good. Dress the part of being someone who's calm and ready to support everyone around you in helping to manage the stress and anxiety that everyone is feeling. Establish a routine. Establish predictability and consistency and structure in your day-to-day life so that you can manage your time in the best possible way. And that includes rest, recreation, distraction, but also time where you might want to get work done. I think it's really important to schedule time where you're reaching out to people and connecting virtually through FaceTime or Zoom or Skype or whatever, Google Hangout, whatever method you can. It's really important we can make sure to connect with people in new and different ways. The third recommendation is giving yourself permission to worry. Take 15 minutes of worry time and spend that time taking a notepad like this and writing down everything you're worried about. I'm worried about myself. I'm worried about my wife getting sick. I'm worried about everyone else in my family. I'm worried about the hospitals and how they're going to manage. I'm worried about all the health workers. I'm worried about the failure of our government response. I'm worried about more people needing to die than we can save. How many lives can we save? These are things that I'm worrying about. But if I put all that worry time on a paper or in a journal, I can dispense of it and have it there, but I then can move on and create and generate myself to be calmer and to take action in support of others. So I think the fourth recommendation is focusing on being social and maintaining physical distancing. So they call it social distancing. It's really social solidarity and physical distancing. So I am really working hard to keep 6 feet away from every other person. I'm sheltering at home nearly 23, 24 hours a day. I'm really working hard. It's a struggle to be socially distanced and also in social solidarity. It's not easy. And then taking this time to develop your quarantine commitments or resolutions, like we do for New Year's. Now, sometimes those New Year's resolutions, we don't ever actually keep them. But if you have a commitment about exercising or doing yoga or developing your spiritual practices, your meditation or your yoga, this is a good time. You have a lot of time to practice that. If you have a commitment about finishing a Netflix show, go ahead and do that. If you always thought about writing a book, start writing it. If you thought about learning a language, start learning it. One of my sons is learning Spanish using Duolingo for free. He made a commitment to learn Spanish during this time. So there's a lot of things that we can do in all this free space that we have that we can talk about. So I'm going to start. There's a lot of questions that came in today, so I love that. Thank you for all these questions. I really appreciate that a lot. So the first question on the list that I'm getting today is, if you go into public, what should you wear to protect others and yourself? So the current recommendations, and I would send you to coronavirus.gov or cdc.gov or the World Health Organization website, who.int. All of these websites are recommending the same basic thing, which is social distancing. That means staying away from other people for at least 6 feet away from other people. It's really important to do that when you're taking walks, or when you're going to the pharmacy, or when you're going to a grocery store, or any other interactions that you're having with people. If you're an essential worker, like my wife is a doctor, she's going to work every day. I've been really working with her to try to ensure that she's implementing social distancing even at the workplace. So social distancing whenever you're interacting with people outside of your pod or outside of your household. That's really important. A lot of people are asking about masks and gloves. So I think right now, as I've started to discuss earlier, there's a massive shortage of hospital masks and hospital gloves. And our hospital facilities don't have enough personal protective equipment that they need to manage the people that are coming in that need urgent medical care. So my recommendation is, if you have hospital masks or N95 masks, keep a couple of them. But if you have a store of them, please deliver them and donate them to your local hospital as soon as possible. If you have rubber gloves that are hospital level quality, I would also recommend keep a few pairs in case you have a sick person in your household that you have to isolate. Then feel free, keep a few set of gloves and a few masks for yourself. But donate, if you have any bulk stored items and you've been hoarding gloves or masks, hospital level masks or N95 masks, please take them to your local hospital. We have to protect our health workers, our doctors, our nurses, our emergency medical technicians that are going to be handling huge numbers of cases. We have to be in solidarity with them, help them stay safe, and help them stay COVID-19 free. So I think it's really important to not overly use these materials. There's been a lot of questions that I've been getting about cloth masks. I think that jury's still out on that, but some of the public officials are cautioning about the use of cloth masks. People have been talking about making masks out of bras and material. I think there's some concern that the moisture that would collect in those kinds of masks can also be a reservoir for aerosolized COVID virus. So I don't have a clear recommendation on that. I would say avoid them right now until we know more about whether they're safe. Okay, I'm going to move on since we have a lot of questions here. Now I got to figure out how to get, there's so many questions. Okay, there we go. Next question is, do I know of any doctors if previous vaccinations to other viruses would or could help the coronavirus be less deadly or more mild for other people? Well, I think that's a good question. There are vaccinations that many of us have taken for the influenza virus that was circulating this year. I think it's for those of you who are immunocompromised or who are elderly, I do recommend getting the influenza vaccine. Most of the United States, the influenza seasonal. Now, why did my computer screen go completely dead? Help. That's really weird. Okay, so I've lost access to my computer for some reason. It just went dead. I'm going to try to get that to reboot. There we go, it's back. But there's no... so it's good if you protect yourself from getting influenza. If you're immunocompromised, you may have already gotten a pneumococcal vaccine or a meningococcal vaccine. Those are vaccines that help prevent bacterial infection that can cause pneumonia. Those things are good to have on board if you need them, or if you've already been recommended to take them, because there can be co-infections. But there are no vaccines that are currently available to protect you against COVID-19. There are vaccine trials that have been started here in the USA, in Israel, and other parts of the world. There's a huge mobilization of medical science trying to develop a vaccine as fast as possible. There has been vaccines that have been developed for other coronaviruses. There are other pandemics that have occurred, epidemics. One was called SARS, one was called MERS, and there have been vaccines developed for those things. So we are looking at, and scientists are looking at, whether or not those vaccines could be available and beneficial for COVID-19. But there's no evidence of that yet. But keep asking about the vaccine, keep putting pressure on the government to develop a vaccine for COVID-19. That will be the fastest, best way to control this virus. So we're hoping right now, experts are saying that in 12 to 18 months from now, we could have a proven vaccine for COVID-19. Now that leads to another question. Someone asked, what happened in the Spanish flu pandemic in 1918 to 1920. Well, that was an influenza virus, and that happened before there was actually an influenza vaccine. And that swept the world when there was much fewer people on the planet. There was about 1 billion people on the planet at that time. Now we have nearly 8 billion people. That virus spread around the world rapidly over a 2-year period, and basically it took that long to get what is called herd immunity, where people either got infected and they got mild or moderate disease, or millions of people actually died during that pandemic. So it took 2 years for it to circulate around the world over 2 flu seasons, because we do know influenza is seasonal. So it peaks in the winter and goes away in the summer months. And that's basically because the influenza virus spreads in relationship to temperature and humidity in the air. And so there are seasonal peaks for influenza. Now, so it took 2 or 3 seasons for the pandemic 100 years ago to work its way through the global population at that time. Now we're in a whole different world right now. First of all, we have 8 billion people on the planet, number one. Number two, this is a different virus. This is a coronavirus, not an influenza virus. It operates differently. And so we are still trying to learn about how it spreads. And every strain of coronavirus may have different characteristics. So the jury is still out yet. We don't know if this has a seasonal variation yet. There are people studying it, and we don't know yet. It's possible that when the warm weather comes in the northern hemisphere, that COVID could be going down, but we don't know yet. We're studying the patterns right now globally in Asia and Africa, where the epidemic seems to be emerging more slowly, but we just don't know if that's because the testing systems are not up yet. We don't know if people are getting sick, and we just don't know about it yet. So I'm not sure yet. We can't say. So the next question is, what percent of the world or U.S. population would need to be infected with COVID-19 for herd immunity to be effective? That's a very good question, and I think we're studying that. Public health experts, epidemiologists are studying that. We don't know the answer to that. The key thing right now to understand is that this is a novel virus. This is a new virus that no one has baseline immunity to. So the starting point is zero immunity. We know that 80% of the people that get infected with COVID have no symptoms or mild symptoms. So that's really good news. That means a lot of people are getting infected and developing antibodies against the COVID virus, but they never get sick or they have mild illness. The challenge we have is that those people that have no symptoms and have mild illness are spreading the virus. So you could be around people that have had the virus and they didn't even know it, and they had no symptoms, or they had even a mild illness. So that's why this virus is so challenging, because people that are asymptomatic or with mild illness are spreading the virus during that phase. And even people that get severe illness can be spreading the virus for 2 days before they show any symptoms. That's why COVID-19 is so challenging. So we don't know. It could take a year or 2 years to get herd immunity. And the question will be if we can, there will be more and more people that are getting infected, and then hopefully within a year or two, a vaccine would be made available so people that don't have immunity can get a vaccine, which gives a kind of virtual immunity or a generated immunity. And then we can have enough people where the virus won't be able to do its damage anymore. So I think that's a 1 to 2 year kind of journey that we're going to be on till we have, what I would say, kind of herd immunity, either through natural infection or the spread of the virus, like what's happening now, or through a vaccine that hopefully will be available in 18 months or so. Thank you for all these great questions. I really appreciate it. The next question is, what do I think about a major city like Atlanta not having testing available and a hospital that would not test an ER staff member with all symptoms? That is a red flag for a response that is failing. And we need to calm down and stop worrying, which paralyzes us. Let the worry happen, but step out of the worry and take action and demand through your hospital administrator, through your county, through your state, through the federal government, that we need to ensure that all health workers have access to testing as soon as possible. That is unacceptable. We can do better than that. We can make sure that every health worker has access to testing. We have to make sure, I know in Atlanta, for example, the ICUs are already filling up. In Birmingham, Alabama, in New Orleans, Louisiana, in New York City, across the New York City area, in Grand Rapids, Michigan, in Detroit, Seattle, hospital ICUs are reaching their max already. And we're still 2 to 3 weeks from the peak in most of these places. So I want to say that we need to really put pressure on our government to get testing available faster to hospitals and health systems. America can do better. We can do better than what's happening now. It's not acceptable to hear a report like that. An ER staff member needs to be protected so they can serve others. So we have to serve them and make sure that they get the testing that they need. I'm staying calm, and I'm being firm, and I'm asking all of us to take action now and not to sit by and lament and sit by and be upset. Now's the time to shift that upset into action, and that lamentation and that frustration into action. And you can do that by going to our website, www.bam2020.world. We have a COVID Action Center. If you sign up for that, you can send letters immediately to the president. You can tweet the president. You can send letters to your members of Congress, to your governor, to your local authorities right away. And don't just do it yourself. Get everyone you know to do it. Only with a loud voice from as many of us as we can get will they start to listen to us. And believe me, I worked in government. I worked outside of government. They want the pressure. They need to know that we're going to hold them accountable. It helps them do the right thing. Right now, you've heard this debate between public health and the economy. And you hear a debate going on in the public arena about saving lives or economic, bringing our economy back. Well, frankly, in my view, the debate is around love versus greed. I am operating in the love zone, and I believe that we should all work together and save as many lives as we can. Right now, the worst case scenario in the United States is that 2 or 3 million Americans will die during this COVID-19 pandemic. The best case scenario could be hundreds of thousands, or 100,000, or 200,000. Let's keep the death down as much as we can. Let's keep it under 100,000, or under 200,000, or keep it under 500,000 people dying, or keep it under 1 million. Let's not let it get to 2 or 3 million. That requires us to take action to protect, test, and treat now. So I'm trying to invite you to be part of the movement that actually determines the outcome of this epidemic. The World Health Organization had a press conference today in Geneva where they said the United States is becoming the epicenter of the global pandemic. Very soon we're going to have more cases than anywhere else in the world. And it's not too late. We can still contain the epidemic if we implement protect, test, and treat. And we have to do that rapidly, and we have to do it now. So let's push our leaders to take action to do that. Please go to www.bam2020.world and sign up for the COVID Action Center and get everyone you know that's feeling anxiety to also do that today. All right, next question. Do any of the doctors know? Oh, I already answered that one, sorry. I answered the herd immunity question. Not true. Okay, next question is, what is the best way to express the severity of the situation to someone who is not changing their lifestyle to fit the societal need of isolation? That's a really good question. Thank you for that question. That's coming from a millennial. So what I've been practicing myself as I experience this myself is the shelter in home and the social distancing recommendations or guidelines that are now being implemented by about 30% of the country is an opportunity to protect yourself, to keep yourself free from getting the COVID-19 infection. And I should tell you that young people are getting serious illness. Most young people are getting no symptoms or mild illness, but some young people are getting very sick. And in fact, the first teenager in Los Angeles died of COVID-19 that was reported yesterday or today. So it's not like young people can't get severe illness. So I think the first thing that I would offer is that protect yourself. You don't want to get COVID-19 illness, even if you're young or old or any age. I don't want to get it. I don't know how my body will react to it. I could be asymptomatic, I could get a mild illness, I could get a moderate illness, or I could get severe illness, and I could get even to the point where I won't make it. So that's true for all of us. We don't know how our body is going to handle it. And that's true for young people and people my age and for our elderly people. I'm only 57, so I'm not considering myself elderly yet. Then what I say to people is, once you're protecting yourself, then you have also an opportunity and a responsibility, I would argue, to make sure that other people around you in your family and in your community don't get COVID-19 illness. And you certainly don't want to get it now when the hospital systems are being overwhelmed. So the whole point of social distancing is to flatten the curve. So the epidemic trajectory can go like this, and our hospital systems can only treat people at this level. So the idea with social distancing is to flatten the curve so that the number of people getting sick never goes above this level, so that our hospital systems can maintain their ability to cover those people. So that's what flattening the curve is. So this is social distancing. If we're successful in social distancing, we can actually flatten the curve and protect the overwhelm of our hospitals. Now, can you imagine having to go to a hospital and needing artificial ventilator to keep yourself alive? And they're going to tell you, we don't have any more, we've run out. Right now, New York only has 3,000 ventilators, and they're estimating that they need 37,000 ventilators. within 2 weeks for when they're going to peak. There's a lot of people in the New York area that might be walking into a hospital and not be able to get a ventilator, or being rolled into a hospital and not being able to get a ventilator. So social distancing is critical to reduce the transmission so that people aren't overwhelming the hospital system. And we know, New York, last weekend, everyone was in Central Park, everyone was at the farmers markets. The people living in New York were not implementing social distancing. So I think that's a lesson for all of us to ramp it up, increase our social distancing, and shelter in home as the government is recommending, and experts. Now, if a person is still not willing to take on this action, I think all you can do is control yourself. And all you can do is walk the talk and practice what you preach. And make sure, look at yourself and make sure you're implementing social distancing in the best possible way. And that's what I've been doing. Am I really doing social distancing? Can I do it better? Can I be better at it? And making myself doing the best possible shelter in home practice, the best possible social distancing. That's all I can do. I can control me. I can't control anyone else. So that's back to what I can do and what I can't do. I can control me. I can't control anyone else. So I'm doing the right thing, and I'm hoping that by practicing what I preach, others will start to do that as well. Okay, next question. Please send your questions. I appreciate them greatly. I want to do a time check here. All right, we still have 19 minutes. So the next question I have is from a person who says, my husband and I had a horrible flu-like illness in January while we were in Las Vegas. Is it possible we could have already had it? Thank you for that question. That's an excellent question, Hope. Yes, it's very possible that you may have had COVID-19 in January. The first case of COVID-19 was identified in Hubei, Wuhan province in China in early December. And I've been studying the migration patterns out of Hubei. People in Hubei travel globally. So people in Hubei were traveling globally all throughout December and all the way in January till the end of January when the Chinese government implemented the lockdown. So for 2 months, the COVID-19 was spreading within China, but also it was spreading globally. I'm pretty sure that the reason why New York is experiencing this huge, rapid acceleration of cases is because they have been, the COVID-19 has been circulating there probably since December or January. And hospitals are now looking back and looking at patients that were in the ICU that had unexplained pneumonias, or what we call it idiopathic pneumonia, meaning a severe pneumonia that they didn't know what the cause was, and they're going back and testing those samples, and many of those samples might have been COVID-19. Now, why this is important for you, Hope, is that I hope you and your husband have recovered and you're back to normal health. You might be contributing to herd immunity. You might already have antibodies to COVID-19. So there's 2 big points about that you need to understand. One is we're hoping that the antibodies that you have, your body's battle against that virus, included developing antibodies to attack the virus when it came into your body. We are hopeful that those antibodies will protect you from getting COVID-19 infection again. Again, we don't know for sure yet, but early indications are that that will be protective. We don't know if that will be protective this season or it will be protective for your whole life. The jury is still out on that question. But what's also happening is that in places that are heavily affected by COVID-19, the doctors are harvesting the antibodies from patients that have recovered and collecting that and then giving that to sick patients. So it's called, collecting the antibodies from someone that has tested positive but has now recovered, and then the doctors are collecting those antibodies and then giving those to the very sick patients to see if that can help save their lives. So that is already starting to happen in medical institutions around the US and probably around the world. I haven't seen any studies yet to show whether that has worked yet, but I know that that work is happening now, and that will increase the study of that possibility. So once there's an antibody test that is available to the public, you and your husband might want to get an antibody test to see if you have COVID-19 antibodies. And then, I don't know, there could be a public donation opportunity where you could donate your antibodies to others so that they can improve. We're not at that point yet, but that is where this could go over the next weeks and months. So keep asking me that question. The only study that I've seen that is actually good news is that there was a study in macaque monkeys done recently, which showed that when they infected the monkeys with COVID, they got severe illness. Then they got better. The ones that got better, they actually re-exposed those macaque monkeys to COVID-19, and none of them got sick. So that was actually really good news. So it looks like the antibodies that get generated are protective. But we don't know if that is true for humans yet, and we don't know exactly how long those antibodies will work. So that is why your question was so good. I hope I answered it. Another question back to the Spanish flu or influenza. Why didn't future generations get flu? Wouldn't they have had herd immunity, and how did it completely die out? Thank you for that question, Sharon. Sharon, influenza virus is, these viruses, they're so sneaky and so devilish. They want to survive. Just like humans, we want to survive. You know that feeling like we just want to live? We all sort of have that. There's something in our DNA that makes us want to live and survive. Well, the viruses they don't have the ability to think the way we do, but they do have the DNA or RNA that makes them want to survive. So the influenza virus actually has an outer shell which changes each and every year. It's constantly mutating. It's constantly evolving. So every season of flu, you have a different influenza virus. And that is why we have developed over time an annual influenza vaccine. The influenza vaccine that you got in 2020 or 2019 was based on the best available information for the influenza strain that was circulating in that year that would affect us. The influenza vaccine was about 50% effective this year. So scientists do their best to try to predict that and create a vaccine each year. New and different vaccine is created for influenza every year based on the circulating or the anticipated strain of influenza that's going to circulate. So the virus that was circulating in 1918 to 1920 actually did die. There was enough. It was global herd immunity, or it wiped people out. Now what happens is people get infected, or they get the vaccine, and so every year there's a new strain that comes, and we get vaccinated. I get vaccinated every year for the flu shot, with the flu shot. So I hope that answers your really good question. It's, let me just see, I have another question here. Okay, this is back to testing. What are my thoughts about a major city not widely offering COVID-19 testing, and an ER, an emergency room, not being willing to test one of their own employees with fever and classic COVID systems? So this is a really important challenge that we're facing right now. I am advocating for a three-pronged campaign: protect the people, test the people, and treat the people. You can learn more about that on www.bam2020.world. In the testing area, we are calling for free point-of-care rapid testing for every person that needs testing as fast as possible. We are demanding that test results be returned in hours, not days. Every effort should be made to accelerate testing of any person that's showing COVID-19, especially testing of health workers and hospital workers. So right now, our national testing program, in the United States anyway, is still not meeting the basic needs. So there are still problems in rolling out testing to the places that need it. So in New York City, for example, the tests that are available now, they're only using them for healthcare workers and for hospitalized patients. That's also starting to happen here in Maryland. Here in Maryland, we still don't have a mobile testing site. It's March 25th. In Dar es Salaam, Tanzania, they've had a mobile testing site up since February. So you tell me, can America do better than we're doing now? Absolutely. Can we put pressure on our governors and our president and our Congress to actually get their act together to implement a response that meets these basic requirements? We need to take action, and now. Don't leave it to them to do this. Please join me. Join a movement to protect, test, and treat the people. I find this to be completely unacceptable that a healthcare worker working in an ER does not have access to a COVID test. That is wrong, and we need to fix that now. That person who is showing symptoms of a fever and other classic COVID symptoms, they need to isolate themselves immediately. The best form of isolation is solo isolation. Go find a hotel room or a dormitory room or some place where you're not around any other people and isolate yourself and stay isolated for 14 days after you get better. The more that we isolate people with infection, the better. I published a blog on my website, I think I published it yesterday, about isolation of COVID-19 is a critical step in our response here in the United States that is not being implemented yet. In China, in South Korea, in Singapore, there was rapid isolation of people with mild or moderate COVID-19 infection. It's very important to isolate. Now, right now, the U.S. government is saying isolate within your family. So if you have to do that, please do that. Make sure a person with mild symptoms is put in a separate room. They don't eat with everyone else. They stay isolated in a room or a space within your living area where they are isolated. They don't walk out of that. They have hopefully their own bathroom, or they have and their food is given to them. And anyone that's interacting with them has to implement the highest precautions of masks and gloves, even within a household. So I think it's really important that we start more aggressively isolating. I'm actually advocating directly to the White House and to the CDC and to the World Health Organization that they do more aggressive isolation of mild to moderate cases. And this is an urgent gap in our U.S. response right now. China and South Korea and Singapore have proven that that's what works, and we are not implementing that here. So we have a lot of work to do, and thank you for that question. I really appreciate it. I have about 7 minutes left. I'm going to take another sip of water and invite you to send any last questions. And please feel free to join me again tomorrow at 3 p.m. Eastern Time or Friday at 3 p.m. Eastern Time. I want to also share with you some other work that I'm doing. I'm working with on a mobilization to bring together organizations and movements to launch what we're calling the Global COVID-19 Emergency Task Force. Our purpose is to draft legislation, support legislation, and lobby governments, including our own, and the United Nations and institutions around the world to accelerate action to end COVID-19. In the United States, we're working on emergency COVID-19 legislation. We've seen our government mobilize three packages of action in the last week, costing about $3 trillion. So they have the ability to do whatever they're going to do. And whatever they're doing is very important. It's necessary, but I guarantee you it's not sufficient. So we need to go forward with the next package of legislation, Step 4 and Step 5 and Step 6. This is not done, and so we're going to be making sure that the public health and economic security needs of all Americans and everyone around the world are met. We must not abdicate the fate of humanity or humans to our elected officials. We must ensure an engaged citizenry. Millions of lives will depend on our efforts. We must do everything we can to save as many lives as we can. We have to hold our Congress accountable for bold and transformational, justice-based action. We can only do this with a unified COVID-19 grassroots movement. We have to put moral pressure on the Trump administration and Congress and governors and local governments, county governments, city governments, and international organizations. We have to be in solidarity with people all over the world to implement emergency COVID action. We must protect our medical workers and people who need our care, need support. We have to have a robust, justice-based economic safety net. The time to do this is now. We have to do this with unity, solidarity, compassion, justice, and a revolutionary love zeal. Revolutionary love to support a global movement to end COVID-19. So I'm really excited that on Friday we're going to have a kickoff call with leaders from around the country and around the world to launch the global COVID-19 Rapid Emergency Task Force. We can no longer be unorganized. We must organize ourselves. We must do what is right for people no matter what obstacles we face. We have to save as many lives as possible. And the last question is, can the Bretton Woods institutions do more to release free money rather than budget support, loans, or better terms? I'm trying to read your question. Is there a precedent? Yes. Thanks for that question, my dear friend Mark, who is a leader at UNICEF, the United Nations Children's Fund. Thank you for your service for all these decades. You're one of my mentors and guides. Yes, of course, there is a campaign that's starting to emerge about dropping the debt, making sure that poor, impoverished countries don't have to pay the money to the World Bank and the IMF, the debt servicing obligations. We were able to successfully do that during the global AIDS crisis. We got all that money transitioned into grant money, and no debt payments had to be paid. There is a very strong precedent for that in a prior global health crisis, as you know, and you know that I worked on that. So we've started to have discussions about mobilizing that support. I'd be happy to work with you and UNICEF and other colleagues to ensure not only it's the IMF, the World Bank, and the wealthy nations have to immediately implement a debt freeze. No more payments have to be paid at this point, and that debt should be relieved. Thank you for asking that question from Central America and Honduras. So I just want to summarize by saying we've had people from Tanzania and Honduras and Europe, from all over the world, all over the United States, joining these calls, these live chats this week. Thank you so much. Please send your questions in. I will be back tomorrow at 3 p.m. If you need my support for a one-on-one, if you're struggling with how to manage yourself or you're having challenges with your family, please drop me an email through my website, drpaulzeitz.org. There's a way to email me. It comes right into my inbox. I'm happy to set up one-on-one calls or smaller group calls as well to support everyone as we're going through this very, very challenging time. I love you all. Let's bring forward our love for each other. Let's help each other. Let's succeed. Let's win the battle against COVID-19. We can do it. We will do it. We will win the battle, but we have to work together, and we have to bring forward love and make sure love conquers greed. Peace and love to all of you. Thank you, and have a great day ahead.